Hello, this is Neil Baum in New Orleans, Louisiana. And this less than 10-minute video is a discussion of how to conduct a practice evaluation, which can be accomplished in just 4 steps. The previous road to success in healthcare is well known to all of us, which includes studying hard, getting license and training, providing outstanding care, carefully document what you did to patients, controlling overhead expenses, and developing relationship with our colleagues. Today's road to success is a little more complicated. We're going to move from pay per volume to pay per performance. As a result, we'll have to be following protocols. We're going to be concerned with the rising healthcare costs. We're going to have to concern ourselves to be participating in coordination of patient care. We're going to have to be comfortable with the electronic medical record and be comfortable entering data into the computer. We'll have to comply with guidelines, and we're going to concern ourselves with value and not volume. This video will cover 4 steps of a practice evaluation, starting with number 1, looking at the long-term goals and motivation of the doctor owner of the practice. We have to concern ourselves, is the doctor at the early, mid, or late phase of his or her career? We're going to have to decide if the practice can run with or without the owner or a full-time producer. A very saleable practice must be sustainable without the full-time producer. The practice must be made attractive to potential buyers. We may have to find ways to increase referrals, participate in more marketing, increasing the cash flow of the practice, and also look to provide a unique service proposition that differentiates our practice from that of our competitors. And we're going to have to control overhead costs. Number 2, we're going to have to provide several years of profit loss statements. We have to make sure that the profits of the practice are increasing. We're going to have to look at the patient volume per month and the number of new patients that are entering the practice. We're also going to have to concern ourselves with competitors within the region or within the community. We're going to look at how long does it take a patient to make an appointment. A practice that has 4 to 6 weeks or more for a patient to make an appointment has a problem that has to be fixed so that new patients and even existing patients can have access to the practice at a shorter time frame. We need to look at our online reviews, making sure our reviews are at least more than 4 stars. We have to look at our patient satisfaction scores. And a practice today is going to have to offer telemedicine or virtual visits. We have to look at the accounts receivable. The majority of the accounts receivable should be less than 30 days. We have to concern ourselves if insurance eligibility is obtained at each visit, and the co-pays and deductibles are collected before the patient is seen by the physician. We also have to obtain prior authorization before the patient is seen by the physician. We have to look at the percent of claims that are submitted and how many are denied, and it is reasonable or expected that it should be less than 3%. We have to look at provider productivity, the number of patients per provider that are seen on a monthly basis. We have to consider taking the productivity of the lease providers and look at them by their average reimbursements per visit. And this is a metric of potential growth if the lowest provider could increase his or her productivity to equal that of the greatest producer. It is true that it is unlikely that the least productive provider will have significant improvement that will equal the top producer. We have to evaluate the practice by the relative value units for each provider. And this is a metric that is used to quantify productivity. And I recommend looking at the number of procedures each physician has performed by the top most popular or used CPT codes and multiply the procedures by the total relative value units per CPT code. And it'll give you the products or the income or the productivity of the most common CPT codes. And this can be used as a benchmark or to compare the practice to a benchmark for practices that are similar within the region, area, or within the country. And this benchmark is available from the Medical Group Management Association. And finally, number 4, look at the talent and morale of the staff. Staff salaries probably represent your largest expense or overhead for your practice, and this can run anywhere from 20 to 30%. Remember from my previous video, patients come second, employees come first, because employees are responsible for patient satisfaction. They are the ones, by and large, who are responsible for the patient experience. I recommend that when you're hiring employees for the practice, hire employees that have outstanding people skills, because you can easily train them for their medical skills. You have to identify problems that need to improve the efficiency of the practice. And this can really only be done if you have regular staff meetings. I also recommend an employee engagement survey. The employee engagement survey is available from the website shown at the bottom of this slide, and it has 10 questions that you need to ask every employee on a regular basis, at least every 6 months. Well, there you have it. Those are the summary of the 4 steps that need to be taken to have an effective practice evaluation. Remember, a practice evaluation is a method of looking at your practice through the microscope to see that your practice is in sync with other practices of a similar nature, or if not, to get the practice back on track or help prepare your practice for sale or merger. Well, I hope you have found this video on practice evaluation helpful and useful. If you have any questions, you can contact me at the email address shown on this last slide. Thank you.